Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the sign and symptoms of the diabetes. The classic symptoms of untreated diabetes are the weight loss, polyuria that is increase the urinations, polydyspepsia increase the thirst, polyphagia increase the hunger. Symptoms may develop rapidly week or the month in type 1 diabetes mellitus, while they usually develop much more slowly and may be the subtle or absent in type 2 diabetes mellitus. Signs and symptoms. In addition, they also include the blurry visions, headache, fatigue, slow healing of cuts, and itchy skin. There are the hunger, confusion, dizzy, grimy and shaky, sweaty, and headache. Prolonged high blood glucose can cause the glucose absorption in the lens of the eyes, which lead to change in its shape, resulting in vision changes. A number of skin rashes that can occur in diabetes are collectively known as the diabetic dermatomes. Complications. All forms of diabetes increase the risk of the long-term complication. These typically develop after many years. 10 to 20. The major long-term complications relate to damage to blood vessels. Diabetes double the risk of cardiovascular disease. About 75% of deaths in diabetes are due to the coronary artery disease. Other macrovascular disease, stroke, peripheral vascular disease. Complication. The primary complication of diabetes due to damage in the small blood vessels include damage to eye, kidney and nerves. Damage to eye is known as the diabetic retinopathy and is caused by damage to blood vessels in the retina of the eye and can result in gradual vision loss of blindness. Damage to the kidney known as the diabetic neuropathy can lead to tissue scarring, urine protein loss and eventually chronic kidney disease, sometimes requiring the dialysis or the kidney transplant. Damage to the nerves of the body known as the diabetic neuropathy is the most common complication of the diabetes. Complications. The symptoms can include the numbness and tingling pain and altered pain sensation, which can lead to damage to the skin. Diabetes related to food problems such as the diabetic foot ulcers may occur and can be difficult to treat, occasionally requiring the amputations. Additionally, proximal diabetic neuropathy causes the painful muscles wasting and weakness. Diabetes amatrophy and next is the pathophysiology generally. Insulin is the principal hormone that regulates the uptake of glucose from the blood into cells of the body, especially liver, adipose tissue, and muscles, except the smooth muscles in which the insulin acts via the IGF-1 insulin-like growth factors. Diabetes pathophysiology is the therefore deficiency of insulin of the insensitivity of these receptors play and a central role in all forms of diabetes mellitus. Pathophysiology, the body obtains glucose from three main places: the intestinal absorption of food and the breakdown of glycogen, the storage form of glucose found in the liver. Glucose is the glycogen liver. Glycogenogenesis, the generation of glucose from non-carbohydrate substrates in the body. So in today's class, I discuss about the following pathophysiology and complications in the diabetes and their signs symptoms. Thank you for watching.